I want to bring in Dr. Joseph Sakran. He's a trauma surgeon at Johns Hopkins and a Brady campaign board member. He's also a survivor of gun violence himself. Doc, I got to tell you, I went from Uvalde to the NRA convention back to Uvalde 2 weeks ago when this all started. And that idea about two conversations really rings true to me. I wonder what you make of that challenge in the debate and how we can fix it if we even can.
Yeah, well, good morning, Garrett, and thanks so much for having me, and thanks for the incredible coverage. Look, I think what we're seeing happening in America day after day, where we wake up with these senseless tragedies, is absolutely horrific. And all of us as Americans should frankly be ashamed. You know, I come to this conversation not just as a trauma surgeon, but also as a survivor of gun violence. And I'll tell you, while we talk about the mass shootings, and they pick up a lot of attention, every day we have people in cities like Baltimore and Philadelphia and Chicago that are being slaughtered on our streets. And so we have, I think, both the opportunity and the responsibility to approach this as a public health problem, where we really think about how do we work together across the different sectors in a multifaceted way to really tackle these gun-related injuries that we are seeing on a daily basis.
I'm so glad you mentioned the shootings in other cities, because I think about this all the time. I mean, I was a local news reporter for a long time, and there were shootings every day in the communities I worked in. How do you get around that it's the mass shootings that seem to drive interest in this issue, to the degree there is any, over on Capitol Hill, but it's the day-to-day gun crimes and gun violence that are taking so many people away from their families forever?
Yeah, exactly. I mean, every day I have to come face to face with the horrific reality of gun violence in our country. And frankly, the American public has been shielded from this. We have to deliver babies to mothers who are dead from gun violence. We have to operate on children who are frankly barely clinging to life because of guns not being, locked and safely stored. And like so many of my colleagues across the public health space, we are frankly sick and tired, Garrett, of seeing this death and destruction that continues to happen. I mean, look at this past weekend: Philadelphia, Phoenix, Chattanooga, right? And these are not just numbers and statistics, right? These are family members, their loved ones, they're people that are part of the fabric of our society.
You mentioned the idea of shielding people. I'm curious, this is a debate within our industry of how much do you show people about what these shootings are really like? How much do you show people what happens to someone's body when they are shot by a bullet fired from an AR-15? As somebody who has treated patients with these kinds of wounds, I'm curious what you make of that part of the debate, that we are perhaps shielding people too much from the reality of the gun violence plague that we're dealing with in this country.
Yeah, I mean, I think that's probably true. I mean, if you think about, this public health problem, we really have sanitized it for the American public. And really the only people that are seeing what actually happens are the healthcare professionals and frontline providers, are those children that are lucky enough to survive, but are in the rooms to see the carnage. And they're the parents and loved ones that have to identify family members. And if you want to get a sense of what it must be like, imagine that your kid is so, slaughtered by these assault rifles that they can't even identify them, and that they have to use a DNA sample to actually confirm identity. To me, it's absolutely horrific. And I think that the American public needs to understand what these weapons of war are doing to our children.
Yeah, I was there that Tuesday night in Uvalde as parents were getting those notifications from DNA results that their kids weren't coming home. It's the worst thing I've probably ever had to cover. Dr. Joseph Sakran, thank you for your time and your expertise today.
Thanks so much for having me, Garrett.